Hi, it's Gene Ransom, and I'm here today with Amy Thomas with Proximal. Amy is the operations manager at Proximal, and I'm really excited because we're going to be talking about working remotely, processes and AR considerations for healthcare practices as we begin to reopen during COVID-19. Welcome, Amy.
Thank you so much, Jean.
So Amy has been the operations manager for quite some time at Proximal, and one of the cool things that I learned about Proximal when I first met Amy and Brian and all the other folks there was they actually run most of their collections division remotely. Can you talk a little bit about how that works and how you do it? And for a lot of my practices who've never done anything remotely and now have some people working at home, what suggestions do you have for remote workers?
Yeah, so right now our collections division, the third party, is completely 100% remote. We did try, and we've had some people in the office in our CBO in Towson, and we actually figured out that there's more productivity when they are remote. But there are different things you have to do to make sure that everyone's working well. So I think for practices that did a quick temporary transition back in March, in order to continue servicing their patients, there's several steps to follow to ensure work is getting done. These are staff members that may have never worked remotely, so there might be a lot going on with their new work environment at home. First and foremost, communication is key with a remote team. You have to communicate almost daily to make sure your employees are doing okay and there's no roadblocks in completing a task. If you're at a management level, always be available while anyone is working, and that's very important. You might even have to bump up some team leads to be firsthand communication to a management position. Second, you want to make sure you're crystal clear on what your expectations are for any task employees are working on. It must be very clear and concise so there's no pushback of non-understanding of a task at hand. And finally, measure what's being done. There's a lot more forgiveness with a temporary remote team. For teams that are full remote, I follow one simple rule with my team. If you can't measure it, you can't manage it. So here's 3 rules that I have either for temporary or permanent remote worker. 1, set clear expectations. This should include deadlines. For example, if something cannot be done in an expected time, then that is where communication comes into play. For example, like something takes 2 hours, it might take longer or shorter, but having that communication is key to productivity. 2, you have to have tools to measure performance. Given the circumstances with COVID right now, measuring platforms have really expanded into daily workflows. Also, most EMR and PM systems have an activity log that can be run to make sure that accounts are being worked daily. And 3, hold people accountable. You have to be fair and clear to your team across the board. You can't have any favoritism or give slack to employees because that'll create a divide amongst your team and create issues.
So that's all very helpful. I think for a lot of the physicians who are opening up, what's happening is they might have some of their staff remotely working, like a billing manager or a billing person or some office folks, and other people be in the office. So that can add some other challenges. I can tell you, when you were showing me how some of the work that you'd implemented with your reporting and monitoring of your employees, it was very impressive. And I do think that folks should reach out to Proximal if they have questions about this, because you lived this before COVID even happened. Speaking though of
Yeah.
the challenges that these practices are facing as they come back in, what they're seeing is volumes are down significantly and less money's coming in. So what are some things that practices can do right now while volumes are down, while they're kind of have people working remotely, while things are kind of in flux, and as we change back to getting to normal, what are some things that you recommend practices look at and do?
Yeah, so I have a couple ideas for this. As we start to return back to the offices, the new work might be a little slower at first. This is a great time to evaluate and update policies and procedures surrounding accounts receivable area. And there's 3 key areas to address. 1, payment policies. 2, balance notification and payment collections. And 3, hardship policy and application. With a payment policy, does your practice have a payment policy for your patient? Best case is the policy is part of your intake form that every patient signs, and if not, have it posted in the front of the desk. This is a policy that sets expectations and responsibilities. The one statement I hear almost daily is, I didn't know I owed that. People just simply don't understand their insurances and what their financial share of the visit's going to be. With payment collection and notification protocols, if your patients have a cost share in the service, you need to tell them that and collect it. There's more of an internal protocol than a policy. Does your staff understand they must collect this, what's due at time of service? If there is a balance, how often are your statements going out to your patients? There's some really cool technology options if you want to invest in something to assist in this area. One of the biggest ones I've seen is companies like Phreesia. They offer like a tablet when you come in or an online application that loads everything in advance for your patients, including the ability to take payments for what's due before they even arrive to the office. You have to set the right culture in your practice to enhance your patient revenue stream. Also, another thing to think about, delinquent accounts process. What do you do when the account falls past due? Do you deactivate? Do you continue to see the patient? Do you make phone calls, collection letters? At what point do you really take actions? Now's the time to really talk about it. Another thing to implement is maybe a hardship policy and an application with that. There are times when patients legitimately cannot pay their portion of the bill. And to be compliant with your carrier agreements, you must have a way to measure your patient's ability to pay the cost share in order to forgive the balance. In most, if not all, agreements between a provider or a practice and insurance companies are a stipulation that you, the practice, will make a good faith effort to collect the cost share from the patient. It's a very vague statement, but to cover your practice, you must simply develop a tool to measure someone's ability to pay or not pay based on finances. And really how your practice values the patient revenue stream is really set by your culture. The practice's leadership needs to set the standard and push them down to every employee so everyone that's working knows what's expected. For example, there's a physician that I go to. If you don't come with your insurance card, you can't even get through the door. They will make you reschedule your appointment. So you really have to, now's the time to really go through those policies and procedures within your practice.
Yeah, I think one of the other things that a lot of practices are probably doing right now is looking at the collection and AR issues, and maybe even trying to do some light collecting. I know we're in tough times, but if you haven't been paying close attention to your receivables and what's not come in, it's you have extra time. It's not a bad time to kind of look at that and see it. And when you look at it, you might start thinking, maybe I really do need to enter into a formal relationship with a company that does collections of some kind. um, when they're making those kind of decisions. And I know Proximal is a revenue cycle management company and a collection company. So I know maybe you're a little biased when you answer this question, but can you kind of tell us, for a practice who might, kind of really look at that AR during this time and go, wow, this is a lot more than I thought it is. I'm thinking I might want to outsource some of these collections. I might want to go with a collection agency. What kind of things should they think about, or what kind of things should they look at as they're trying to make that decision, Amy?
Well, I will try not to be biased at all. This is something I tell any practice administrator that comes and talks to me and asks these questions. Selecting the right partner is critical to success, not only with third-party collections though, but any outsourced area. When you're looking for a collections partner, there are a lot of options out there. There's over 4,000 agencies in the US alone. And believe it or not, most of them are small operations under 15 employees. And overall, in the area of debt collection, bigger isn't always better. With any decision you make, you want to vet out several options before making a selection. There are several keys into selecting the right partner for your practice. You want an agency that's in good standing and has a good reputation. Get references, check Better Business Bureau, or ask for a letter of good standing. And you want an agency that understands healthcare. Not that they've just done collections, but they understand the importance of the relationship of a medical practice or provider with the patient and the community as a whole, and how to answer basic questions for your patients like insurance. Some of the clients we actually have access to their EMR system. So when I'm talking to Johnny that doesn't understand why he owes $875.67, I can go in and actually see an EOB and explain what a deductible is. You'd be surprised how many people do not understand their health insurance. Another thing, you want to make sure the process that the agency uses meets standards of your practice and a reflection of the reputation in the community. Healthcare debt is not the same as credit card debt or buying a Ferrari or anything like that. And most people do not choose to be in healthcare debt. Another thing, verify the debt collection process with the agencies. What steps do they take? When do they send letters? Do they use auto dialers versus live agents? How many agents do they have? Another thing to remember is, do they report to credit bureaus. That's ultimately up to the client, but you want to know if they are or not. Another thing is, where are they located? Do they outsource? Do they do offshore? You want to ask how difficult the onboarding process is. What kind of system do they use? Can they view what they placed? Can the patients or debtors at that time pay online? With our platform, we have a very simple debtor port or a client portal that the actual client logs into and can see how many times we've left a message or sent a letter out or talked to them. So many times I'll have a client reach out and be like, hey, Johnny coming in for an appointment and he said he never got a phone call, and I'll send him all the dialogue of all the times we possibly talked to him and everything. And that's you really want to be transparent. Another thing is, what kind of reports do you get monthly and how do you get paid? You want to ask that. And one complaint I consistently hear is the lack of communication, transparency once those accounts are placed. Just remember, using an outsourced partner is on your terms and supposed to assist you in solving a problem and not adding any more work to the plate.
So I think that's all really good advice. And one of the things I will say about your company is that I have actually met a lot of your collectors and know who they are. And that's cool. It's not, you don't have a big call center out in India. You have real people who are right here in Maryland who make the phone calls directly. So I think that's a good segue into maybe telling everybody what is Proximal and who are you guys?
Yeah, so we're a medical billing and third-party collection agency. With the third party, we only do medical debt. We're dedicated to provide clients with the best customer service, and we have over 15 years experience in the healthcare field. A lot of people don't know, but we're a wholly owned subsidiary of one of the largest pulmonary private practices, Pulmonary and Critical Care Associates of Baltimore. So we're actually physician owned. Some of the service lines we provide are billing, coding, claims processing, accounts receivable, practice management services, and third-party collections. We really focus on being the expert in revenue cycle management so the practice can thrive in a doctor-patient relationship. We want to bring clarity and control to your practice by really taking an in-depth look at practice flow, identifying any issues, and then providing solutions. No matter as a whole or in part, a partnership with us ensures that a practice will collect the maximum dollars due and allow your provider and office staff do what they do best, which is really care for the patient.
So the other cool thing about Proximal is that you do revenue cycle management as well as collections. You kind of do the whole package and help with receivables from the beginning to the end. I did also want to say that you can always reach out to MedChi, and MedChi, the Maryland State Medical Society, is happy to help you with any questions you might have about billings, collections, revenue cycle management, legal issues around it. And I guess I just want to say, any closing thoughts or comments, Amy, as we wrap this thing up?
Well, my email's up there on the screen. If anyone wants to reach out, I'm more than happy. I know there's still some rules and regulations going on with private practices and reopening and everything, but as you know, most things can be done remote, so I can always take a phone call and do a Zoom meeting or anything to help a practice that might have any questions. We do offer free consultation, but we look forward to helping any practices that are trying to get back on their feet or even just go through their processes right now and offer ideas and suggestions to help increase the revenue.
Amy, thank you so much for spending some time with us today and helping us with some suggestions on dealing with AR and remote working.
Okay, great. Thank you so much, Jean.